what do we know already about dental handpieces or the drills or any of the dental burs? What can you guys tell me about that? So, you've been working on instrument ID. Hold on. Wait a minute. I'm going to wait for that. What do we know already about dental burs and handpieces? What can you guys tell me? What do you guys know about them? What are they used for? What are they? What can you guys come up with?
The tools used by the dentist for different stuff, like removing decay.
Yeah.
Shape teeth.
Yeah, so Sabrina said, remove decay and shape the teeth. So these burs and instruments, they're used very often in dentistry, daily. It's the most common thing used in dentistry. So the first thing I want to talk about are handpieces. So the dental handpiece is the most used instrument in the dental office. Or might I say restorative dentistry. So the most used instrument in restorative dentistry, so fixing teeth. Okay. So the handpiece provides the motion for the rotary instrument or the burr. So the handpiece, it provides the power for the burr. But we want to be more specific and say the rotary instrument. So it provides power to the rotary instrument. Okay. So when we're talking about handpieces, for the rotary instrument or the burr, what do they actually look like? Well, we've got a couple of examples up here. I'll go more in depth on these later, but I have a hygiene handpiece, I have a laboratory handpiece, and then I also have a high-speed handpiece. This hygiene handpiece is also called the slow-speed handpiece, so we'll determine these as the high-speed handpiece, the slow-speed handpiece, and the laboratory handpiece. But we'll go into that in more depth. So this is about the handpiece, right? And the final thing about the handpiece is exactly what Sabrina said, right? It does the actual cutting and polishing of the teeth. So this is the instrument that's used to actually cut or polish the teeth. Okay. So those are the hand pieces, the actual thing you're holding, right? This is a hand piece. This is the hand piece, and this is the hand piece, okay? And then we want to know there are two main types that you'll see in a modern office. So there are two types. And those two types, what we just talked about, high speed in slow speed. The high-speed handpiece is the one that looks like this in one unit. The slow-speed or hygiene handpiece has different attachments on it. Okay. So I want to focus on today these two main types, and I'll also give you an example or examples of the 4 auxiliary types that you might see in the office. Okay? So the handpiece is the most used instrument in restorative dentistry, like cleaning teeth. Provides power to the actual burrs. It's used to cut and polish the teeth. And we have 2 main types that we use daily, the high speed and the slow speed, okay? Let's take a look at the slow speed first. The slow speed handpiece. So we want to talk about what is the slow speed handpiece, what are the uses of it. So let's talk about what it actually is, the slow speed handpiece. What is it? Well, the slow speed, the speeds of it is 5,000 to 30,000 RPM. So 5,000 to 30,000 rotations per minute. So 30. Okay. The other important thing about the slow speed handpiece is that it can be arranged in such a way where the rotary instrument or the burr can either go forward or backward. So if you look at our attachment, if you look at the top, this angle looks a bit different than this angle here. So this allows you to spin it off and rotate this around so you can go forward or backward, okay? That's key to know about these. Right? So what can you do with it? Well, so what can you do with it? So what is it? It's a slower speed. It's 5,000 to 30,000 RPM. You can move it forward and backward, but we can use it with a couple different things. We can use it with 3 different attachments. So 3 attachments. What are they? Well, the first one that you guys are familiar with is the prophy angle, or the prophylaxis attachment. This is the one that we use when we're cleaning teeth. So this is the example that you'll know off the top of your head. So 3 attachments. One is the prophy angle. Okay. The second one is the straight angle, or just straight handpiece. the straight handpiece, it literally looks like this. You can make an attachment that looks just like that, just straight. And then the third one is the contra angle. So if you look at this handpiece, you notice how it's straight, but then it curves upward. So that angle is called a contra angle. So that you can have an attachment called the contra angle. N-T-R-A, C-O-N-T-R-A hyphen angle. Contra angle. So we want to know, what are the uses of the slow speed handpiece in dentistry? Well, we have clinical uses and we have laboratory uses. The clinical uses are to remove soft decay, right? You guys know the spoon excavator. That's used also to remove soft decay, but often in the dental office, after the dentist uses the spoon excavator, they will use the slow speed to remove soft decay. They use the slow speed so they don't damage the tooth structure more than they have to. Or it puts them at risk, or it lessens their risk of damaging tooth structure. The high-speed handpiece goes really fast, so if you slip, then something could happen, and if you're inside of the tooth, you need it to be slow and controlled. So it's used to remove soft decay. And we all know with the prophy angle, it's used to polish teeth. So polish teeth and remove stains. Right, that's why we call it coronal polishing when we're using the prophylaxis angle. And coronal polishing, that's the act of polishing, cleansing the tooth surface, and removing it of any surface stains. Now the slow speed can't remove excuse me, deeper stains, like in the dentin. However, on the surface level, it does a pretty good job. So those are the clinical uses, and there are 3 laboratory uses. So let's go down here with these 3 lab uses. The first one is, well, it's basically to trim and contour. So you're trimming and contouring any of these things, crowns, or a temporary crown. So we'll just put crowns. Also, they're used for adjusting like porcelain. Now nowadays, with modern lab techniques, we don't often mess around with porcelain fused to metal crowns. However, if you were to encounter one, you would want to make sure to use a slow speed handpiece. So you, when we're talking about porcelain, I don't know how to spell porcelain, but you guys can look that up for me. Actually, P-O-R-C-E-L-A-I-N, porcelain. P-O-R-C-E-L-A-I-N. So trim and contour crowns, trim and contour porcelain, and then it's also used sometimes to trim and contour the root canal during endodontic treatment. I forget the word when you're cleaning out the root canal. Obturate? Is that, you guys are familiar with that? Obturate. So, the slow speed, what is it? It's a handpiece that can go from 5,000 to 30,000 RPMs. You can move it, you can adjust it so it goes forward or backward depending on what you're trying to cut. And we've got 3 attachments that are most commonly used: the profi angle, the straight attachment, and the contra angle attachment. The clinical uses of this handpiece: to remove soft decay after usually a spoon excavator is used, and to polish or remove stains in the case of chromo polishing. And it's used to trim and contour 3 things mainly: crowns or temporary crowns, porcelain fused to metal crowns or the porcelain around it, and also to clean out root canals. Okay? I want to talk about the high-speed handpiece, and then we're going to get a little bit into burs. There's a lot on burs or rotary instruments, so I'm going to cover them briefly today, but let's talk about the high-speed handpiece. So the high-speed handpiece is used for shaping and contouring tooth anatomy or the structure of it. So when we're doing that, our straight or high-speed handpiece, it's one unit. It's one thing. You can't take it on or off anything. Whereas this, you can put a lot of different things on it. This is its one single thing. So this is the high-speed handpiece, or a high-speed contra angle handpiece. So high speed. High-speed handpieces. So for the high-speed handpiece, it's a little faster. And it needs to be able to cut cleanly through the tooth surface. So how much faster? Well, a lot. It can go up to 400,000 RPMs. This is the handpiece that freaks people out when they come into the dentist. This is the one that you hear. This is the one that's going 400,000 RPMs, the high-speed handpiece. The high-speed handpiece is operated by air pressure. So that's why we turn on our air and water in the back, and we have to build up pressure in our system for the burr to operate. So this operates by air pressure. Okay? So we hook it up to our tube. It's operated by air pressure, so if there's an air leak or something happens like almost a year ago where the tube from the wall kept popping out, then you wouldn't have air pressure. If your compressor's not plugged in, then you're not going to have air pressure, your drills aren't going to work, or your handpieces won't work. So high-speed handpieces are also cool because they also utilize the water from the dental cart. So they're water-cooled systems. That's why you can toggle the water on and off, but they're water-cooled. Since we know anything that goes super, super fast is going to get super, super hot. We don't want that. So it's sometimes connected with a water line that sprays water and circulates it through this handpiece. And the way that burrs get into this is a friction lock or a what's that called? That locking key where you screw it in. So there's 2 different ways. It's friction, just you put it in and it's good, or you have to twist it in. Friction or dental burr key. Make sure you write down burr key, because if you look up a dental key, that's a very, well, I'll leave it at that. If you guys want to look up dental key, you can. Just it's an interesting instrument. Okay, so we looked at, what is it? Well, it's a really fast handpiece that can go up to 400,000 RPMs. Now you don't have to operate it that fast, because remember, we control that by that foot pedal or the rheostat, right? The foot pedal that makes the drill go faster or slower, we control that with the rheostat. Spelled R-H-E-O-S-T-A-T, rheostat. Okay, now let's talk about the uses in dentistry. The uses are pretty similar, but you can get a little more specialized with this one. So the first use is you can also remove decay, right? You can remove decay, you can remove tooth structure, you can remove a faulty restoration. I'm going to mix those all together. Tooth decay, a bad restoration, or tooth structure, healthy tooth structure. Okay. So a lot of similar things, but remember, we're moving a lot quicker. So it's a lot faster, it's a little more technical, right? It takes a lot of years of practice and training being able to master the high-speed handpiece. That's why it takes dentists so long, so many hours and hours and hours of practice just to get the dexterity to be able to use it safely in the mouth. And then we have a couple of specialized uses. So the main one I want to talk about is just sectioning teeth or removing large, bulky pieces of bone. So teeth sectioning. So when I'm saying sectioning the tooth, that means if, like in oral surgery, if I'm trying to take out a tooth but I can't wiggle it out, I would have to take my rotary instrument and split it in half. So the high speed is used to section the tooth or split it in half, or in multiple halves. So it's used to split it up. And then the final one for more general dentistry is for polishing restorations. So the high-speed handpiece, since it's moving a lot quicker, it's going to be a lot smoother on the restoration. That's why we have to use such a high speed, right? If you had a rough, bumpy drill like the slow speed, then you're going to get a lot of scratches and stuff because you're bumping all around. You need that high precision. You need that high precision to polish restorations. Okay? So that's the high-speed handpiece. Now there are 4 others that I'm just going to have you write down. They can be used in your office, but most likely you'll be trained on how to use them in your externship or at your job. The 2 that you would most likely see is the laboratory handpiece. Like if you're working at Aspen Dental, they do a lot of actual lab work like we do here. So you might see a lab handpiece, or you also might see an ultrasonic handpiece if you go on to hygiene. The ultrasonic hygiene, or the ultrasonic handpiece, is used to do scaling and root planing. So let's write this down here on this side. You're still writing that down. So others you might see. Well, the 2 main others you'll see. I just want you to write down what they are so you're familiar with them. Because the high-speed handpiece and the slow-speed handpiece, you'll see them no matter what. These depend on where you work. So these are other handpieces. And then we'll talk about burs, and then we'll be all set for today, for this part. So our lab handpiece. And you can write down, it goes up to about 20,000 RPMs if you want, just for reference. Okay, that's the lab handpiece. And then again, if you're going on to hygiene and you're doing scaling and root planing, then you'll see the ultrasonic handpiece. We all have done dental records and charting, so I'll abbreviate scaling and root planing, as you guys know, as an SRP. Cool? Those are the two main other ones. Now, if you're in more advanced, not advanced, but if they have more technology at this office, or they do a lot of cosmetic, if that's like the only thing they do, then you might see these other twos. So, I'll put them here. You might see these. Well, I'll put it 3 and 4. You might see an air abrasion handpiece. Air abrasion. It's basically a small version of a sandblaster. So, air abrasion handpiece. Air abrasion handpiece. What I want you to know about this is, again, it's a small version of a sandblaster. So I'm gonna write sandblaster in parentheses. But we also need to make sure we know what is actually coming out of that. So it's something called aluminum oxide. It's a bunch of aluminum and oxygen coming together. So I'm gonna put aluminum oxide. And if any of you guys are chemistry fans, that's abbreviated as Al2O3.
Of course, Jackson.
If you guys are just curious, if you want to write that down, I don't know. It's got 2 aluminum and 3 oxygen atoms. So, anyway. So the air abrasion is kind of like a sandblaster, and it's shooting out these particles of aluminum oxide. Okay? Aluminum oxide.
So you'll clean your crowns out with it, and like if somebody come in and the cement in the crown, you'll clean like the cement out, or stuff like that is basically what we need, what we've used it for. We don't really use it for much else, except when it comes to crowns. Everywhere I done worked at, that's got it, just crown stuff.
If I had,
edges.
yeah, like, just like noble metal crowns, like just getting a bunch of stuff. Like,
Yeah,
it's
and
really
you
good
have to-
for,
Yeah,
like,
you gotta be careful, because it'll take, like, doctors will tell you if you're dealing with a certain type of crown with material, what to take the material off of it. I forgot about the laser.
I just wrote laser in red because I think lasers are cool. But the laser handpiece. So the laser handpiece just uses a big beam of laser light to vaporize tooth decay. So that kind of sounds cool. So,
Go ahead.
or just basically it uses the high intensity light to kill the cells and get rid of it.
Yeah, and it helps with bleeding.
Mm-hmm.
And if you do implants, your doctors might use the laser to, for like the second step of implants, which is stank, but it does.
So it
And
removes.
you'll have to wear glasses when you're dealing with that. And you will never do it, the doctor will do it. Use the laser.
So the laser handpiece, just put a high intensity light. It's a high intensity laser beam. Oh wait, it's an S. See? I'm too tired for this.
I was wondering why
It looked weird.
why you put the
Yeah, I
V,
know, I don't know.
But I was like, well, maybe he
Nah,
wants to
nope.
be groovy.
Nah. Make sure,
Just like,
make
did
sure
you
there's an S
put,
there.
is that a U or 2 C's for structure?
U-C-T-U-R, yeah. You guys
I
get the
don't
point.
know, maybe he was feeling a little, groovy today.
Not that much. So, high intensity laser. Lasers, like for 1950s comic books, they put the Z and look cool like a beam. Anyway. But it uses a high intensity laser. And the benefits of it is it's painless and you don't have to wait for anesthesia to work. So the benefits of this laser, spelled with an S, is it's painless. And you don't have to, or patients like it because you don't have to wait for the anesthesia to work.
But they also use it for crown lengthening too, the laser.
Mm-hmm. Yeah.
And so the gingivectomy might be.
Yeah. We'll talk about all that next week. Bunch of perio. I love crown lengthening. At first I was confused because I thought they were actually building up the crown. I'm like, how does that work? Until you realize that they're actually getting rid of gums.
Mm-hmm.
But so those are our handpieces. The two you'll see, depending on where you work, is the lab and the ultrasonic. And then depending on what you do, what your office does, you'll see air abrasion or the laser handpiece. Okay? Now, real quick, I want to talk about the rotary instruments, or the burs. So the actual little tiny things that you can put in. So these things right here. You keep them all in a box, and I'll be careful, but there's a lot of different burs we have. We've got gold burs, we have titanium burs, we have lab burs, we have different number of burs. So most of the time in your office, these will be labeled, but you do have to know what they look like in case they're not. So, burs, or rotary instruments. The first thing I want to talk about that you'll need to know for this ICA today, and just in general, is the actual shape, or how it's constructed. So, here we go. There are three different parts. There are three different parts of a burr, or a rotary instrument. We have the neck, we have the shank, and we have the head of the burr. So first, the shank. What's the shank? So these are our burs, or rotary instruments. They're called instruments, and there are a lot of them because there are different variations. So they all do something different, so that's why we call them rotary instruments. They fit inside of the handpiece. So the three parts, and I'll do a pour dive, let's see. The first part we have is the shank. This part right here of our burr. If this is an example of a burr, this long part that goes into the handpiece is the shank.
first one?
Mm-hmm. So this is the shank. Actually, maybe I'll color code it. We have the shank, the part that goes into the handpiece. The second one is the head of the handpiece. So this portion right here. The actual different shape it has. So we have the head. And this gives the burr the name in the shape, or provides the shape which gives us our name. So we have our shank. This is the part, I'm going to use a laboratory burr. Notice how it's a lot larger, and we'll talk about this. But the shank, the long part that we actually put inside of the handpiece. The head of the burr is the thing that gives it the shape and the name of the burr. But there's one other thing that you might see on a different type of burr. Whereas this looks like it goes straight from the shank to the head. And I know you guys can't see it, it's microscopic to you guys. But I hope you get the idea. But you notice the long shank and then the tip up here. I think I drew this one, sort of. But then where it deviates in to get to that really small ball at the end, that's the neck, right? So just like any other neck, like the neck of the tooth, that joint there, this right here, this portion is the neck. And all you need to know about the neck is that it connects the shank with the head. So the neck connects the shank to the head. So this is our basic anatomy of pretty much the majority of dental burrs. But the final thing I want to talk about today are the 4 different types of burrs that you'll see. So the first one, we have an example, we have diamond burrs, we have finishing burrs, we have abrasive burrs or discs, and we have different accessories to those, and we have some laboratory burrs as well. So the first one I want to talk about is a diamond burr. Now, diamond burrs are very expensive. Dentists use them often for crown preparations, but at Children's, where money was a little tighter, we used carbide burrs, which work just the same. I actually like carbide burrs a lot better than diamond burrs. I like the way they cut, but it depends on the doctors. A lot of the doctors at Children's, we were trained on carbide, but when you go into private practice, if you can afford them, versus working at, Children's, if you can afford it, private practice, then they'll probably use a diamond burr. So let's write up diamond burr, and then we ought to talk about what that is. So we have 4 types. I'm going to write these up here. Burrs. What's the name for a burr? What do we call them formally? What's the formal name for a dental burr? Rotary instrument. Okay. The 4 types of rotary instruments. right, what was the first really expensive one I talked about? Diamond. So let's talk about them. The diamond burr. What is so special about the diamond burr? Well, we just know they're used for crown preparations, right? You could use a carbide burr, you could use a diamond burr. But they're used for crown preps. Crown preparations, preparing the tooth for a restoration. And I want to tell you about the most frequently selected of these. So which ones you'll actually see in the office. So of the 4 types, there are 4 different variations or selections that I want to say. The first one is the round diamond burr. The round diamond burr. This is the one that I drew up here earlier with that little small ball at the end. The round is used for access to the pulp chamber. Because it can go super fast, it can go really deep with it. It's a very small instrument, so you can get down into the pulp chamber without any worry. Then there's another type, and again, you can look up pictures in your textbooks of these, but they're basically how they sound. The second type that we have is the flat end tapered burr. And all this is used for is just to reduce more tooth structure. So again, your dentist is going to ask for whatever they want, but you can know as an assistant that if they don't tell you, you might want a round, you might want a flat end taper to reduce that structure. The third one is kind of a freebie, but this is the flame burr. It's used very similarly. So the flame burr actually does the same thing. It looks like a little candle flame. You know that also reduces the tooth structure.
That is that's common. That flame is common. You should always have that on the burr block. Your doctor, every single doctor I ever worked with, they want that.
We call them goldies. See, I can't. So this is a diamond flame right there. You guys can pass that. So the flame burr and the flat end taper both are used in crown preparations or tooth preparations to reduce the structure of it. Then we have the wheel. So I've only seen the diamond wheel used once in pediatric dentistry to remove structure by the gingival margin. So the fourth one is the wheel. And it kind of looks like a donut, right?
I need to see what, because you know the verbiage is different. I
Yeah.
don't be knowing like the actual,
What they call it.
yeah, like
Everyone.
the wheel sometimes. I don't
Yeah.
know. Huh? What's that? Oh yeah, you can put it up here in that box.
All right, I'm gonna put, the wheel is used to reduce the subgingival margin, okay?
Which one was in?
Right there. Thank you. Okay? If you want to get real specific, you can call them subgingival bevels. So, or bevels. Bevels in that tooth structure, right?
Excuse me.
Oh, my bad. I'm like, huh?
No, excuse me, Tim. I can't see.
It's still not on there? Oh, no. Alright, I'll let her know again. I don't know what's going on with that. She said you probably need to try on your laptop too, but I don't know what the difference will be between the laptop and the desktop.
You didn't work at home, so I don't think
You said it work at home?
so. It didn't. I told you about on yesterday. On the page.
So out of the four, we talked about the diamond. It's used for crown preparations. We've got different types here. The second one is the finishing burr. It's similar in appearance to the diamond burr, but it's used for polishing restorations instead of preparing them. So they're similar in appearance, but the one thing I want you to know is that at the working end or the head of the instrument, the number of blades or flutes on it are increased. So you have, how do I want to say this? The surface area of blades are increased on this. So I'm going to write a big arrow, increased blades or flutes. Those sharp edges at the end. And then if you're taking notes, you might want to just draw an arrow, but the finishing burr has the same types as these, except just these three. So you can draw an arrow, just know it has those three types there. The round, flat end taper, and the flame. Okay. And then two more short ones, and then we'll end for today. Does all this make sense to everybody? Very similar, except the only thing that's different is there's an increased number of blades on that working end, or the head of the rotary instrument. This is the key part for the finishing burr. Okay. The final two I want to talk about today are your abrasive instruments and your laboratory rotary instruments. So up here, I might pass around this laboratory burr. Again, I talked about the shank of the laboratory burr is increased. It has more torque to it, so it has to have more surface area to grip onto. But it's a more heavy duty, more like a drill bit, if you want to think about it like that. It's a heavy duty burr. So, and then the second one is I brought up examples of these. These are abrasive instruments. Now, these are discs, but they can't go on the instrument just like that. You have to have something to go with it. So there's some accessories, such as this accessory right here. It's called a mandrel. So let's talk about these real quick. So number 3, the laboratory instruments, or the laboratory burrs. labbers. These are used for the lab. And just know they have a larger shank and a larger head. So an increased so let's pass this around. Again, like this one we saw earlier. The neck is shortened. This is increased. It's a lot more heavy duty. So I want you guys to look. This is an example of the laboratory burr. So it's a lot more heavy duty, and you can tell it apart from any clinical burr you might use. It's a lab burr. So we had our diamond rotary instruments, our finishing instruments, lab burrs, and then we have these, again, these abrasive instruments. So number 4, the fourth and final type, well, not final type, there are dozens of specialty ones that you can get in the nitty-gritty, but these are the ones that I want you to know. We have abrasive. So our abrasive instruments, they come in many different shapes and sizes. So you might have these wheels, you might have points or cones or something like that. So, and they're usually flexible. So variety, they have a variety of shapes, and they're usually flexible. So up here I have polishing discs. That's an example of one. You might have a polishing point, which is more of a rubberized polishing material. So I'm going to write down some examples here, just 2 examples. We have the wheel or the disc, and then we have a polishing point. Okay. Polishing point or a polishing wheel. Or a cup. Yeah, let's put that up there. You'll see that too. Point wheel or a cup. Similar to a Profi cup, but it fits on it a little differently. And the final thing I want you guys to know for today is that if you're using a polishing disc, this number 1 up here, you have to use something called a mandrel. Okay? So this disc, if you look at one, there's a big hole in the middle. How would you suppose I put this on here? Well, that doesn't make sense. So for using one of these polishing discs or wheels, we have to use an attachment called a mandrel right here. That's spelled mandrel. A mandrel is a polishing disc accessory. You need a mandrel if you're using a polishing disc. So So for example, I have my mandrel here. If I get a proper size disc, I can snap the disc onto the mandrel and then now you can then insert that into your handpiece. I can get it in one piece. You guys see how that's arranged? So on its own, if I'm using a polishing disc, that can't go on the handpiece by itself. I need that extra part that called a mandrel, an accessory, so I can put that disc on it and then insert it into the handpiece. Does that make sense? So this little metal part is called a mandrel. And in your dental office, we never had enough and we always lost them. So be careful and watch out for your mandrels. Okay? How does everyone feel on that? Does that make sense? So we talked about high-speed handpieces, slow speeds, and we talked about different like diamond burrs and burr shapes. So in your dental office, you're gonna have to know the types of burrs, what they're used for. You'll need to memorize a couple and what they look like, because a lot of dentists will ask for the same ones over and over and over. But a good rule of thumb is just ask them what burrs they like to use.